Good afternoon. My name is Elizabeth Hess. I'm here with the administrator of the Champaign-Urbana Public Health District, Julie Pryde. Thank you to the City of Urbana and Mayor Diane Marlin for letting us do this today. We have an update on COVID-19. Thank you so much for being here today, Julie.
Thank you.
Since last week, the number of diagnosed cases has jumped up tremendously. Last time we talked, there were no test kits available. Are there any locally?
There are some test kits available now. The thing is, we always had test kits available to us. The problem is the guidance from the federal government is only allowing us to test certain people. So you have to have symptoms plus a travel link. And that's very hard to do, and that will not show any community transmission. So we were getting very few through. Starting last Friday, Champaign became a sentinel test site, and that means that if someone has influenza-like illness and a negative test for influenza, and their physician or healthcare provider feels that they are eligible for this type of testing, then those can go through. So I know right now we probably have at least 10 in right now.
You are so accessible, and people ask questions on Facebook, and you opened up the Facebook group for that. Let's start from our own medical community. Meredith, an internist, asks, our patients call to get tested, but we don't have any. When should we expect them?
Well, that's a wonderful question. What she's actually asking right there is, when would primary care providers have what's called point-of-care testing? Ideally, everyone would have that very, very soon. I cannot give you a date because if I did, it would change by the time I got back to my office. They are right now still pushing them through the state. They are supposed to have commercially available lab testing starting this week. And that would mean that if you go to your doctor and you get just like you go for anything, you get a swab for, let's say, influenza or strep throat, and then you could also get one for COVID, and then they could send them off to either Quest or LabCorp laboratory. The problem with that is it takes about 3 days to get back. So the guidance when healthcare providers do get that, our guidance will be to make sure that people are self-isolating until they get the results back.
Is the test the same, a nasal swab, or is it a blood test? How do we get tested?
You get tested 2 ways right now, and both are required. One is a nasal swab where it goes up inside of your nostril and they swirl it around there, and the other one is a different swab and it goes down your throat. So like a throat culture, you hear people say. So they go in there and swab your throat. Both of those are what is being sent out right now, and that is testing for actual infection. What we would also like, aside from widespread testing for the illness, is we would also like an antibody test, which would be a blood test, which would tell us if someone has already been infected and cleared it.
I know I asked this last time, but the answer may have changed. People have flu-like symptoms right now. There are a lot of viruses going around. When should we call our doctor and see if we should get tested, and when should we go to convenient care?
Ideally, if you have any type of influenza-like illness, call your healthcare provider first before going in. The goal being, we want to make sure that you're going in a way that you do not risk transmitting whatever you have, whether it's flu or COVID or anything else. We don't want you to risk transmitting that to the healthcare providers or to the other clients who may be in the waiting room. So if you call first and get advice, then they will be able to guide you.
Another Facebook question comes from Diane. We pick produce, we touch apples, we press elevator door buttons. How long can the virus live on those surfaces?
So the good news is that this is a virus that can be killed relatively easy with the typical household cleaners. And if you look at them, the disinfectants, it will say coronavirus on the can or the box or whatever you're using to clean with. It can be cleaned with a solution. It can be cleaned, sunlight can kill the virus, but the issue is the answer is so varied based on everything from humidity to the type of surface it is. Is it permeable? Is it semi-permeable? What is it? So the main thing that we're trying to get people to do, because you're going to assume that every time you leave your house and go into any public place, assume that your hands are contaminated. If you're buying fruit or something, obviously you're going to be washing that fruit to begin with, so that's not so much of a concern. But getting your hands dirty is a big concern. And if you can avoid touching your face by the time you get home, and then start making it a practice that as soon as you go into your home, wash your hands for at least 20 seconds, wash them really well, and then go about your day.
We all wash our hands and then turn and pick up our telephones. How often, how vigilant should we be about cleaning our phones?
And that is another issue. I mean, there are a lot of issues out there that are causing, that are going to cause problems, and that is one that every single time I wash my hands and pick up my phone, I'm like, contaminated. So, because your phones are filthy, they're just filthy. So if I could put everyone in one of those dog cones that you see, so that you cannot reach around to touch your face, I would
always
do that.
touching our faces.
We always touch our faces. I do it as well as anyone else. I am not immune to that, even though I know better. I always remind people that knowledge does not equal behavior change. So if you can work with other, your friends or your family members to try to check each other and prevent doing that, or at least call each other out for a while to do it, that may help. But it's one of those things that's really hard to do, but it is the way that potentially you could be infecting yourself, even if you stay away from other people.
If I don't have access to a sink and soap and water, is hand sanitizer a good alternative?
Hand sanitizer, as long as it has at least 60% alcohol in it, it is a good option to use. Always if your hands are visibly soiled, you want to go find a sink and clean them off. But yeah, if you just have touched, and you'll notice around our community, there's hand sanitizer everywhere. Use it. I noticed that the kiosk, when I go into the doctor, it's there before you touch the keyboards. So it's there for before and after use. So anytime you can use it, that is great. But it's not something I think that we all need to just be carrying it around with. And I get a lot of calls. People are stressed that it's not out at the stores anymore. Soap and water is ideal. It's worked forever, long before there was hand sanitizer. So it does not have to be a special soap. It just has to be soap and water. It is the friction, it's the mechanical action of removing the virus from your hand, which is what you're doing when you're rubbing your hands together, and also the slickness of the soap helps to remove it.
This morning there were reports that there have been cases reported in Milwaukee and Chicago, Indianapolis and St. Louis. Champaign-Urbana converges from all of those cities. How soon do you suppose we'll get positive results from tests?
We are expecting to see cases any day now. We're not, the rest of the U.S., including us, is not seeing cases because we're not testing, because we do not have enough access to testing. As that expands, expect to see cases everywhere.
Once we self-quarantine, let's say we have symptoms and it's 14 days, how soon can we go back out into the community?
So if you are under quarantine, that means that you are exposed but you're not ill. So we're wanting you to remain away from others and away from gatherings and things like that, and monitor yourself for 14 days. And you do that in conjunction with public health. And when your 14 days are up, if you don't have symptoms, then you're able to go out right then. Now, if you are someone who is ill with COVID and you have tested positive, you will be put in isolation for 14 days, but the isolation could go longer or it could be shorter based upon when you're clear. So you will not be released from isolation until you've had 2 negative tests.
If you're young and relatively healthy, you could get COVID-19 and you could recover from it. The population we're concerned about are seniors, who it's harder for them to recover from this. What should they do now in terms of they want to go to meetings, they want to go to conferences? How should they handle that?
Right now, because people over 60, and they are saying people over 60, although the older you get, the higher likelihood of having serious complications. So anyone over 60 with underlying health conditions, something like a heart disease, lung disease, cancer, you're immune suppressed for either because of disease or medications, uncontrolled diabetes, anything like that, they are having really negative health outcomes, and you can see this all over the world, not just in the cases in the United States. The suggestion from the CDC is to avoid any mass gatherings. Now that can be anything from going to church or a religious organization. It is anything going to meetings or conferences. It is, they have been told not to get on cruise ships at all, and also to consider just talking to your family as well, because if you have someone in your family and you're a young healthy person, but you're taking care of someone who's immune compromised or ill or old, you need to consider that as well. Another thing I like to tell people to think about when they're talking about travel, because I'm getting absolutely tons of questions about, should I go to this conference, should I go to this, should I travel? You need to think about more than will you just be infected with it. If you look at what's happening, whether it's the cruise ships or certain planes or different things like that, if someone is exposed on that plane, they may be put into quarantine where at their destination. They may be put in quarantine when they get back. We can only speak to what happens in Champaign County when you're under quarantine. We can't speak to other places in the country. So you have to think about that. And then let's say you're in quarantine for 14 days after you traveled somewhere. So let's say you took a week off, you go on vacation, you're exposed there, you come back, you're in 14-day quarantine, meaning you can't go to work, you can't do a lot of stuff. And then at some point during that, you become a case because you become infected. That then adds on another 2 weeks or more to that. So, I mean, there's a lot more during a pandemic to think about than just, will I personally have a good chance of faring well? And I always like to remind our community, too, because I keep hearing that, well, it's only the old people. Well, those old people, as people like to say, are someone's mother and grandmother and spouse and friend and important. You know, it's not like it's okay just because this tends to be harder on the other end of the spectrum. And those of us who are out running around, we do not want to be the ones to infect someone and have them have a negative outcome as well.
If someone is a senior and let's say they enjoy going out to restaurants, hourly employees don't have the luxury of paid time off. So somebody could show up at work to a restaurant and serve somebody. Are you saying that we should be careful having our seniors go to restaurants, go to shops, and do anything out?
Anytime that you are around someone within 6 feet, you stand an opportunity to get infected if that person is infected. Right now, we're not having known community transmission, so we're not necessarily making those type of recommendations. But everyone needs to make their own personal risk, do their own personal risk assessment. What is my condition like? You know, how sick am I? How much trouble have I had with other illnesses, for example, flu or something like that? And they need to decide for themselves, is this worth risking getting sick from and potentially having a serious complication, a long hospitalization, or even death?
Where are we with masks? Are face masks even useful at this point?
Face masks are important for people who are ill when they go into the healthcare provider, for example, or they are important for the healthcare providers to have. For the general public, the only good that a face mask will do is potentially keep you from touching your nose and your mouth because it is on your face and it's a reminder. If you do that, I would really love for people to make their own mask. Make yourself a cloth mask. It's not going to prevent viruses from coming in. It will serve the same purpose for you coughing out, but the main idea is to keep you from touching your face. So, no, they're not recommended, but if you can come up with clever ways to keep from touching your eyes, nose, and mouth, more power to you. Share them with us if you have them.
Yes, you are very accessible again on the Facebook page for CUPHD. I'll have you give that at the end. Is it likely somebody's walking around this community with the virus?
It actually is likely that someone has the virus in our community. Whether they're walking around, I don't know. They could already be in quarantine because they were caught through a travel screening. But again, the travel screenings are not that great. They were great at the beginning when it was just coming from one place. But now, unless it's a high-risk country, still they're not being screened. I can tell you that the University of Illinois has done an absolutely amazing job. The universities, they know where all the kids are. They know if they're studying abroad and whatever, and they can make recommendations to them that go above and beyond even what the Centers for Disease Control is saying, and that is good news for our community. So the students that are coming back from study abroad are going into 14-day quarantine, and they're being monitored, and they're reporting symptoms and things like that. So that is a good thing.
We are in an election year, and that seems to lead the news cycle. Should COVID-19 be leading the news cycle? Should we be more worried than news cycles are letting on?
So here's the deal with that. COVID-19 is a pandemic. I don't know why they're not calling it a pandemic. Anyone can Google or look up the definition of a pandemic. It is a disease that has worldwide spread, sustained spread on more than one continent. We have it on 6 continents out of 7 right now. There are sustained outbreaks, massive outbreaks going on all over the world. So we are in a pandemic. People need to know that pandemics last not weeks, but months, and it could last well over a year. Typically, you don't get out of a pandemic until you have a vaccine and you can get herd immunity up either through everyone being infected and then becoming immune or people being vaccinated. So it is very important that people focus on what we can do locally, because our goal locally with something that's as big of a situation as this is to think about what our community is going to need. And I keep getting all these questions, and I keep saying, this is a community issue we need. We need people to start thinking about, if we have closures at some point in this community, because we have as widespread as what's going on in Washington or other places around the world, how are we going to take care of everyone? That's not going to be public health running out and taking care of everyone. We need people to start talking with their families, their friends, their neighbors, their coworkers. Start planning on how you're going to communicate within your neighborhood to help drop off food if needed, or drop off items that are needed for people that may not be able to take care of themselves. And there are a lot of people in our community who cannot stock 2 weeks worth of food. They don't have the money to do that. They are not going to be able to fare well if they don't get to work for 2 weeks or more because of a closure or a quarantine. So it's going to be a community effort. It's going to take lots of attention from every creative individuals all the way up to governments. It's going to take everyone involved in this. Churches, religious organizations need to be involved. The schools are involved. Everybody needs to think about it. Food banks. In fact, this week, our food bank at Champaign-Urbana Public Health District, our food pantry, is going to a different model. We're not going to have people congregating in our lobby and shopping. What we're going to do now is put the bags together and hand them out. We'll be meeting people at the door. We'll be meeting them at the bus. We'll be meeting them wherever they are and give them the bag, and they can go with that. That seems to be the underlying theme, is what you were expressing today, is try to stay away from group congregations. Absolutely. And again, places where older people get together or get into crowds, that is potentially a problem. Before I let you go, what can we do to minimize the spread of this virus once it does hit Champaign County officially? So what we can do in our own community is to do the things that we're already doing. They're constantly trying to wash our hands, stay 6 feet away from people. People need to stop shaking hands, stop hugging in public. It's time to stop doing that now. Get ready. We don't want to wait until we have cases. People just need to get used to that. Hey, during a pandemic, we're not going to shake hands. It doesn't mean we're rude. It just makes good sense not to do that. We don't need to hug in public. We don't need to, we just don't need to touch each other in public during a pandemic. We need to be unbelievably vigilant with hand washing. And these things do work. They actually work, and they've worked in large pandemics. We need to stay home. We need to listen to the guidance that's coming out and do it. If we are saying, if you even remotely have a sniffle, do not go to a long-term care facility. Do not go there. People are going to have to start thinking of alternate ways to visit people. If you have people in long-term care, both the long-term care facilities and the families need to think of other ways to be able to visit during this, because you do not want to have an outbreak in a long-term care facility. We just saw what happened in Washington, and that is instructive for the rest of the country. So church, recently a priest was diagnosed and had given communion, and he shook 500 hands over the weekend. So are we supposed to stop doing things like that? Yeah, at some point we will absolutely make that recommendation for the entire community if we get community transmission. Right now, we are already making that recommendation for seniors to it's not worth risking infection. So yes, we are telling people, if you're seniors, really evaluate your travel and stay away from mass gatherings. And in a lot of situations, churches or temples or mosques or religious organizations do have, they are considered mass gatherings. Where should somebody go for the most up-to-date information? Keep looking at our page. It's Champaign-Urbana Public Health District's website, www.c-uphd.org. We will try to keep things on there, printed materials. We put these shows on there. We will link the most updated information that we have. And like I said in my most recent Facebook post to the community, know that we are trying to get stuff out as fast as we can and as accurately as we can. But, you know, mistakes will be made or guidance will change, and we will update it as soon as possible. But always assume, and not just with public health, but with all of the other places that are working on this, and there are a ton, assume positive intent. We are trying our hardest.
We know.
Everyone is trying their hardest. And we are not going to hide behind we're not going to keep any information. We're always out there with stuff. Like I said, it's a pandemic. Why they're not calling it that, don't know. They can call it a chocolate donut for all I care, because we're going to be doing the same things. So, but we welcome questions. We will try to answer them as fast as we can, and we will put together frequently asked question lists. So we appreciate everyone doing what they can to help us spread information. So, you know, we like to say spread facts, not fear. So help us get the correct information out to people. I just want to encourage our community to really start thinking about this. We have brilliant people in this community. We have creative people. I want people to start thinking about what can we do if we get into a situation like other countries are in right now. What can we do to make sure that we are being able to communicate with people effectively, that we're reaching everyone? Ask yourself, what can I do? What can my business do? What can my employer do? What can my church or religious organization do? And start figuring these things out and help us to get this information out in the community. Because while public health leads the efforts during a pandemic, we certainly do not lead all efforts. We are going to be doing what we've been doing, asking for everyone's help, everyone's cooperation, and to get us through this.
Thank you for everything you do. Thank you to the City of Urbana and Mayor Diane Marlin. Thank you to our producer, Jason Liggett. But most of all, thank you to Julie Pryde. You're the administrator of the Champaign-Urbana Public Health District, and I know you give your staff a lot of credit as well. They're all doing a wonderful job.
They are, and so are our community partners.
Thank you.
Thank you.